So good morning, everyone. Thank you so much for joining the Exploring Public Health webinar. My name is Kayla McLaughlin. I serve as the Pre-College Outreach Coordinator for NC-HCAP. That's an acronym that stands for North Carolina Health Careers Access Program, and we are located at UNC Chapel Hill.
And I am Daisha McFall. I am a Student Services Manager in the UNC Gillings School of Global Public Health.
All right. So very briefly, I just want to talk to you a little bit about NC-HCAP and what it is that we do and what we can offer to high school students and parents as well. We have pre-college as well as college initiatives. For now, I will only focus on the pre-college initiatives. Our mission is to increase the number of individuals from disadvantaged backgrounds who are educated, trained, and ultimately employed in the health professions. The importance and our vision for the world. NC-HCAP envisions a society with equitable access to culturally competent healthcare across all racial ethnic groups, irrespective of geographic location, whether that be urban or rural or socioeconomic status. In short, NC-HCAP's goal is to eliminate health disparities. All right, now I'm going to introduce Miss Daisha McFall. She's going to talk to you a little bit about public health and what exactly Gillings can offer to you.
Hi, everyone. So a little bit about me. I'm an early career professional in higher education. I've been working in the School of Public Health for about 4 years now. When I graduated high school, I had plans of going to college and becoming a medical professional, but things didn't work out quite the way I thought they would. And so over the course of my time at UNC, I remained involved with the Health Careers Club here at NC-HCAP, and I explored a couple of different majors before landing on exercise science, and I thought that was the way I was going to make an impact on people's health across the world. But shortly after graduating, I found that I had a passion with helping people in other ways, and now I do that by helping people gain access to the education and training they need to make a difference. So I work in the School of Public Health, mainly with graduate students with some undergraduates as well, helping them explore the different career options in public health and what they need to do to get there. So next, we're going to talk to you a little bit about what public health is, what your career options are, and how you can pursue a career in this field. So the American Public Health Association frames public health as a field where doctors treat people who are sick, but those in public health work to prevent people from getting sick or injured in the first place. So contrary to many beliefs, there are many ways to affect the health and well-being of the world without being a medical professional. Public health is exactly what it sounds like. It's impacting the health of the population as a whole. So scholars and professionals in public health work to address issues that affect the public's health. From my perspective, there's something for everybody in this field. Students who are heavily math and science oriented, students who are medical minded, as well as those who may have more of a theoretical or social background, as well as the policy folks. These professionals all work together to promote and protect the health of people, the communities they live, work, and play in. So it is important to note that the medical field and public health are not mutually exclusive areas. There are plenty of doctors, nurses, and other medical professionals who are trained in public health, and we actually encourage that in Gillings. We want our medical providers to be well-versed in prevention and education as well as they are with treating issues people face. So at Gillings and at other schools of public health, there are several different majors people can take. So you have biostatistics. So a lot of our students who are very math-centric, they're really good with numbers. They find a lot of joy in the biostatistics field, and they're doing a lot of the background work on crunching numbers that help run the research that guides the decisions we make in public health. Environmental sciences and engineering, they do exactly that. They do the research and the engineering that helps the environments around us work for us. So that could be working on water, it could be working on air pollution, countless other things that are involved in the environment impacting our health. Epidemiology, they like to call themselves the disease detectives. So they are, that you may hear about them going to countries where there may be an outbreak, such as the Zika virus or malaria in certain countries. They are going into these countries to figure out what these diseases are, how they're spreading, and how we can stop them. In health behavior, the department I work at, we're really focusing in on what are the underlying factors that impact health. So why people make the decisions about the health that they do, or why their environment may impact them. So for instance, you may wonder why certain people are more susceptible to obesity, but when you look around them, the only accessible food they have are fast food restaurants. And so that's exactly what we're doing. We're doing interventions and evaluations in the community to help shift health behaviors. Health policy is exactly what it looks like. So whenever your family is taking a look at their health insurance plan, they're wondering how all of the talk going on in the Senate right now is going to affect their health care. That's exactly what this field is doing, to help people understand and help drive some of the policy that helps people have access to proper health care. Maternal and child health is looking at the health and well-being of mothers and children, and nutrition is looking at the food you eat and how that impacts your health. So you may wonder exactly what you can do with this. So these majors kind of have huge names, and some students may be able to kind of grasp what you can do with them. But here are some practical careers that you may not think of when you think about public health. So your first responders, the paramedics who come to treat you whenever there's an accident, they're trained in public health. They're helping you, they want to teach you how to prevent these things from happening in the first place. We have health educators who may come into your school. This may be a health teacher at your school, it may be somebody who works at the health department, or they may come and speak at health fairs in the community to really teach you about proper protocol. It could be dentistry, it could be with eating the right foods. We have community planners who think about how buildings and infrastructure around us impact our health. Again, we have those disease detectives I talked about and the policymakers, but there also may be people at your mom or your dad's workplace who are occupational health and safety professionals who are making sure that your workplace is a safe place to be. Even aside from obvious threats, just posture and the way you sit could impact your health. So we have occupational health professionals who are there to guide us and make the right decisions. We have nutritionists, we have researchers who do a lot of the work to help us figure out why things are the way they are, so that the practitioners in the field can apply that to make positive changes. We also have health inspectors. So they may be inspecting buildings, they may be inspecting the restaurants you eat at to make sure they're healthy places to be, as well as social workers who go into the communities, into homes, to make sure that everyone is happy and as healthy as they can be. So some of the work environments these people are in, we typically see a lot working in local nonprofit organizations, as well as community centers and health departments. But there are ways to make real change on a large level, and that could be through working at large research organizations that put out lots of data all over the world to help inform health decisions people make. There are some big names you may have heard of, the Center for Disease Control and Prevention. You may have the National Institute of Health and the World Health Organizations, and these are all global organizations that are working relentlessly to protect the health and well-being of all of our citizens. So if you're thinking about a career in public health, I would say this is a good time to kind of start thinking about what your next steps would be. It used to be that a lot of people kind of found this field along the way. They may have gone to college, or they may have joined the workforce and then explored different things going on around them and wonder, why is this the way it is? And public health professionals are helping to address some of those issues before they even become issues, or they're doing work to help alleviate disparities we may have in the places we work, live, and play. So to kind of get started, the best thing you could do is research public health and how you fit into the equation. Kind of explore how you could potentially make a difference in your community. And then from there, take a look at any majors or programs at colleges that interest you to get a head start on what it takes to even get into those programs. So there's been a growing presence of bachelor in public health majors. It used to be a heavily graduate degree focused field, but because there are so many people interested in impacting the public's health, we've seen a surge in the number of colleges and universities offering bachelor's programs, and that's a great opportunity to get your foot in the door as soon as possible. So research those programs and find out if there are any classes you need to take in your first year or two of college, if there are any volunteer opportunities you should begin looking into. These programs can help advise you on what you need to do to kind of get your foot in the door. From there, there are several public health symposiums that take place over the summer that really immerse students in the essence of public health. So here at UNC in the Gillen School of Public Health, we have several summer youth symposiums. We have some for high school students that brings them here for about 2 days in the summer to get them on the ground working with professors in the field and students who are studying public health to learn all about what this field is and what their potential to make a difference could be. There are also programs for students once they're in college to really learn a little bit about what the research side of public health is and train them for future work or studies in the field. And so once you kind of have an understanding of what public health is and where you can make a difference, explore where you can get your education in public health. So there are several universities that now offer bachelor's and graduate programs in public health. So reach out to those programs. Don't be afraid to ask questions. It's always more important to ask questions and have too much information than to not have enough. So make sure you're prepared by researching public health and researching the schools and universities that offer these programs. And then keep in touch. I am available to talk with students as well as a lot of my colleagues in the School of Public Health, but you have an excellent resource here with the NC-HCAP program and Kayla, who are here to outreach with all of you high school students and parents and let you know about the various career options you have in public health. And we're all more than happy to keep in touch with you and help you find the career option that is best for you.
Absolutely. Absolutely. Thank you so much, Ms. McFall. Keeping in touch is definitely a really important part of your future and how successful that you become. And I'm going to put our contact information here on the screen. There's contact information for Ms. McFall as well as myself. There is a phone number, email address, and then under my contact information, I have a doodle link. In terms of pre-college students or students that are in high school, I want to hone in a little bit on ways that we can service you. So one of those ways is for advising. If you want some additional support aside from your guidance counselor outside of high school, if you want to know how to pay for college, if you want to know what classes you should be taking, if you want to sit down and take a look at your transcript along with your parent, you can reach out to me and set up an appointment there. We can do that via Skype, via conference call. If you're local or if I'm in your city, we can definitely meet in person as well. There's a lot of other different events that we have that NC-HCAP sponsors, like Health Careers Day on the Hill. We do community health fairs here in Chapel Hill. So please take a look at the NC-HCAP website, take a look at the Gilling's website to find out what we have going on and where you fit in and what kind of opportunities are available to you. Thank you so much for joining the Exploring Public Health webinar, and please feel free to reach out to us